All the time I see people that have shoulder pain. There's lots of different possibilities for what is causing your shoulder pain, and especially if you have a pinched nerve, which is common with shoulder pain. A pinched nerve often causes refer pain, so it can be actually difficult to localize where the pain is. So I would recommend you seeing a health professional that's actually good at that can find out what's actually causing your pain. But in any case, the Teres Minor muscle is one of the rotator cuff muscles. There's 4 muscles that make up the rotator cuff. This is one of them. It is right here. I'm hitting it right now. So if you try touching here and pressing a little hard and you feel tingling down in your arm or it hurts a lot, there's a good chance that you're suffering from this syndrome. And the way we treat it is, in the clinic, is we do some active release through here to get the muscle to relax, and then we'll do some adjusting in some of the ribs, etc. But what we're going to do right now is teach you an exercise that will be part of that rehab. Now, just to get a little bit more into the anatomy for a second for the Teres Minor, this muscle pinches sometimes, if it gets really tight, can pinch 2 different nerves. One of those nerves, called the axillary, goes right to the deltoid, to this part of the shoulder, and the other nerve, called the radial nerve, goes all the way down into the hand, around the thumb area. So if you feel a lot of tingles down the arm, this is one possibility for where that pinched nerve could be from. One way of thinking of it is it's kind of like having sciatica in the shoulder, the piriformis muscle in the hip being the muscle that's similar to the Teres Minor in the shoulder. In any case, what we're going to do to rehab it is, this is a very easy exercise. I'm on my side. You want to use no more than 5 pounds to start with. For this muscle, no more than 5. 2 to 5 pounds is perfect. You can even use no weight. You can just go through the motion without any weight at all, and it's fine. If 2 pounds is even too much, which is okay. So I'm on my side like this. I bring my arm in, I tuck it in, and then I put my arm up. I point at the ceiling in front of me, and I count 1, 2, 3, 4, and bring it in. And that's the entire exercise. I'll go through that again, but I want to explain what I just did. That's called an eccentric muscle contraction. What that means is we're stretching the muscle while it's contracting. It's the opposite of what usually happens, which is that it contracts and shortens. And it just turns out that tremendous amount of healing takes place during that eccentric phase of muscle contraction. So we're going to do it again. Up. This part doesn't matter. It doesn't really matter where my thumb is so much. But now that I'm all the way up, I point my thumb at the wall in front of me and I count 1, 2, 3, 4. I don't bring the hand any lower than my shoulder. It's just at shoulder height, and then I just bring it in as fast as I want to go. So do that 12 times. 1, 2, 3, 4. In. 1, 2, 3, 4. Get both sides. Even though I'm only working on my left, for example, get both sides so that you stay in muscular balance. And that should do it. You can do up to 3 sets of 12, and you can do them all at once, or you can scatter them throughout the day, and that's fine as well. All right. Thanks a lot.